past. So if we're all ready, shall we start? So I'd just like to quick reminder to other presenters that if they're not on mute, could they please put themselves on mute until I hand over to you. So welcome everybody to today's Edge Talk, and it's really excited to have everybody here today. And this is a subject that's very dear to me. It's on the DNA of care and the importance of listening to staff stories. And we've got two presenters here today. That is Karen Deeny and Pip Hardy. Can we go on to the next slide, please, Pip? So there's ways you can join today. If you're joining us for a live session, you can take part via the chat box, which is on the lower right-hand screen of your session, and contribute during the session. Or you can tweet using the hashtag EdgeTalks. And the other handles you might want to consider is School for Change Agents and the Edge NHS. We also have a Facebook group, which is part of School for Change Agents and the Edge, so feel free to join that. So we'll be happy to get involved and carry on the conversations after the session. So let's just look on who's in the team today. So have the next slide then, Pip. So in our team today, we've got Lewis, who is monitoring the chat. I will be your session chair for today. And then we've got Paul behind the scenes, who's supporting us with the technical aspects of running WebEx. So thank you all for your help today. So our presenters today, we're really thrilled to have these two presenters. I met Pip Hardy from Patient Voices about 3 years ago when she got involved with school, and I've learned so much from Pip on the benefits of patient stories. And then we've also got Karen here, who works for staff experience in NHS England, and this has been such a fantastic piece of research of work that they've been doing, and I'm really thrilled to have them both here today to be sharing with us the importance of sharing staff stories and developing these to improve care. So I'd like to hand over to Pip now. Thank you.
So good morning, everybody. It's really lovely to be here doing this Edge Talk on a grey, rainy Friday morning. So we thought we would just start off by introducing ourselves very briefly before launching into the rest of the presentation. So I guess we probably don't need to say very much more because Kate has already done such a lovely job of introducing us. Thank you, Kate. But Karen, you probably might like to say something?
Yes, thank you, Pip. Good morning, everyone. And it's an absolute pleasure to be able to join Pip, Kate, and the team today. So, just very briefly, I wanted to say at this point that the staff experience work programme that I'm leading is within the patient experience team at NHS England, and I hope as we work through our slides today, the significance of that will become even clearer. So this is very much about the interface of staff experience and patient experience. The whole programme is about that, and specifically DNA of care relates very strongly to that. Before we move on, I also just wanted to ask Damon Camming to take the opportunity to introduce himself. Damon is one of the very special people that made a story, a digital story, as part of the DNA of Care programme, and we're delighted that Damon's been able to join us today. So if I can just ask Damon to introduce himself before we go on with the rest of the slides.
Hi, thanks, Karen. Hi, I'm Damon Camming. I'm a consultant anaesthetist and have been so for 11 years at UCLH. And I had the pleasure of making a digital story with Pip. And it gives us an opportunity, I think, to listen to each other and to learn from each other. So I'm delighted to be here. Thank you.
Thank you, Damon, and I'm delighted that we'll be hearing and experiencing Damon's story later in our presentation this morning. So, can we have the next slide? Thank you, Pip. So, just very briefly, why are we here today, and what we'd like to share with you? So, we want to give you some background about the DNA of Care project. We want to talk about the potential of digital stories and some of what we've learned through them, particularly about how they reveal really important truths about the staff experience and really reveal some of the essence of those experiences. We want to share some of the stories with you. We'd like you to hear from some of the storytellers. Damon's here with us today, and others have kindly made recordings to share. And we'd also really like to inspire you to share your own stories. And then the next slide. So, the essence of why this is so important is really that staff experience absolutely drives patient experience. You can probably hear I've just lost my slides. But focusing on that is absolutely the most important thing for the system to do. We've tended in the past to focus either on staff experience or on patient experience separately, and a really important move for us to make as a health and care system is to focus on that interface, the interface of staff and patient experience. So, and just drawing briefly, lots of you will be familiar with the work of Michael West. That really evidences very strongly that employee engagement is just the best predictor of NHS outcomes, and nothing else is as effective as that. We've known that for some time. What's really important now is to work in ways that really respond to that evidence and take it very, very seriously. And the DNA of Care is one example of that. So, put simply, as in this lovely graphic here, that captures a conversation I had at Expo last year with one of our patient leaders, is patient experience and staff experience, put simply, are two sides of the same coin. And we really need to understand what matters to patients, clearly, but also what matters to staff. And if you think about a coin, looking at a coin, it's very difficult to see both sides at the same time. Really important to flip the coin, to look at patient experience, staff experience, pay attention to both, and recognise that inextricably linked. And even more simply, again from Michael West, it's just so clear that both staff and patients need care, compassion, and respect. This is not a staff thing or a patient thing, it's a people thing. And also learning from Kenneth Schwartz, the inspiration behind the Schwartz round. Kenneth said something really powerful at a time when he was at the end of his own life, and particularly brought to our attention the importance of patients experiencing their interaction with staff when staff reveal something about themselves that makes a personal connection for that patient. Kenneth recognised when he said this that some of the rule books might frown on that kind of very intimate and close engagement between those delivering care and those receiving care, where the staff reveal something of themselves, their vulnerabilities, their experiences, their feelings. But I think Kenneth asks us a really powerful question when he suggests that maybe it's time to rewrite that rule book and start to think and act differently. And a good story, and this presentation today will be very much about stories. A good story is so much more than simply a good story. And certainly the digital stories that we'll share with you today are precious opportunities for learning, for reflection, and for transformation. And I think at this point I'm going to hand over to Pip, and Pip's going to take us through the next few slides. Thanks, Pip.
Thank you, Karen, very much. So, some of you may know the work of Fuller and Cohen. They wrote a very interesting book called The Heart of Change. Really what they found, the most important thing, was that we actually need to speak to people's feelings if we're really thinking about bringing about change. We can give people all the data in the world, but unless they're touched by something, it's very unlikely that that change will happen. And of course, a lot of you will be aware that change, it's got to happen at an individual level before it can happen at an organizational level or a social level. So people's feelings are an important, really key aspect of change. One of the things about stories, and this is a lovely quote from Brené Brown, who some of you may be familiar with. She does a lot of research about vulnerability and courage and the links between the two. But she talks about stories being data with a soul. So I think it's really helpful for us to consider stories as a different kind of data, a kind of data that can complement the data that's presented in statistics and graphs and charts and so forth. So we started the Patient Voices program in 2003 for exactly the reason that we wanted to offer a different kind of data to counterbalance the statistics and graphs and charts and so forth, because what it seemed to us, and Tony Sumner is my colleague in Patient Voices, is that statistics tell us the system's experience of the individual, but we need stories to actually tell us about the individual's experience of the system. So for us, that's been a really important part of why Patient Voices is important. And this is probably the other most significant reason that we feel that stories are important, that there are so many people engaged in a massive enterprise of healthcare who are waiting to be heard and who don't have a chance to be heard, because one of the hardest things in life is having words in your heart that you are unable to talk about, feelings that you're unable to express. So with Patient Voices, we were very clear right from the outset that we didn't want to hear stories only from patients, although of course that's very important, and back in 2003 it was even more important. We wanted to hear from all of the people involved in healthcare who are waiting patiently to be heard, and the digital story format, as you'll see, gives people a wonderful opportunity to be heard and seen using exactly the words that matter to them, rather than the words or the ideas or the questions that might matter to the researcher or the consultant or the interviewer. So moving right along to 2015, a few years after Patient Voices had been going, we had done some work with NHS England, actually with people with a learning disability, and we had worked with them to create digital stories. And they're being used in education and training and so forth. And so Neil Churchill, who's the head of patient experience at NHS England, said, would you be interested in doing some staff stories? So we kind of leapt at the chance, and because it has always seemed to us that the staff experience and the patient experience are, as Karen said earlier, inextricably linked, and we need to listen to the stories that will connect all of us in order to learn the important lessons that are necessary to provide the best possible care. So we ran 5 workshops. We were hoping to get 8 people to each workshop, but of course, as inevitably happened, people got busy at the last minute, or their children were sick, or they were sick, but we still had 33 storytellers, which is a good number. One ambitious person actually created 2 stories, and what they told us about afterwards was that the workshop opportunity provided them a chance to reflect, to gain insight into their own experiences, as well as the experiences of other people, to connect with one another, and also often to connect with the reason that they went into healthcare in the first place. And for very many people, it was an opportunity for personal healing. I just wanted to tell you a little bit about what happens in a digital storytelling workshop, because it's not really quite like anything else. The workshops take place over 3 days, during which time people have an opportunity to share their ideas for a story in a story circle, and then they work really hard to refine those ideas into a script of about 250, 300 words, which is approximately 2.5 to 3 minutes, which seems to coincide remarkably with the 21st century attention span. People seem to get bored after 2 or 3 minutes and start looking out the window or checking their phones. So it's a perfect length for a story, but it takes a considerable amount of work to actually really hone your ideas down to such a relatively small number of words. But because people use pictures as well, you can actually say more, of course, with pictures than you can with words alone. So these are just a collection of pictures from the workshops. But I guess what I wanted you to see was the kind of complete absorption of people working, how diligently they are looking at their laptops, thinking about their scripts. So we then, if people may bring along pictures that they want to use, and we scan them or they have them on memory sticks, and we show people how to use digital video editing software so that they can actually put together their own video. So having recorded their voiceover and identified what images they want to use, they basically get to play with really cool software to make their own movies, which for many people is really empowering. But I think the important thing for us is that it means that the storyteller gets to tell exactly the story they want to tell. And once they're happy with it, we won't edit it, chop it up, change it. So it maintains an integrity that we feel is really valuable and important. Interestingly, when we fed all of the scripts from the 34 stories into Wordle, the most frequently used word in all of the people's scripts was the word patient, which I think is a kind of lovely tribute to the commitment and dedication of the people whose stories we were hearing. So we'd like to show you a story now made by Natashas Karen, who is a colleague of Damons. Natasha is also an anaesthetist and a pain consultant, and we'll show you her story. And then she unfortunately wasn't able to join us today, but she's done an audio recording just to tell you a little bit about her experience. So here's Natasha's story. So I hope you liked that lovely story that Natasha made. So this is Natasha, a very beautiful picture of her. And I'm going to play with the audio that she recorded, but she wasn't able to be with us today. So here's Natasha talking about her story. So thanks to Natasha, and we'd love to hear from any of you now who have questions or comments. Unfortunately, of course, we don't have Natasha with us, but Karen and I and also Damon will try and answer your questions. So I guess that I think there are enough of us, so that if you'd like to ask a question, perhaps you could unmute yourself and ask us, or you could put a question in the chat box if that's better for you. Any comments, thoughts? I'm seeing some things in the chat box. People are obviously finding it's quite powerful. But yeah, I wonder whether you have any other comments that you'd like to make.
Hi.
Hello.
Hi, it's Mel.
Hi, Mel.
Hi, how you doing?
Good, thanks.
I mean, I'm partly crying, partly smiling, just finding this all really fantastic, and I love the kind of digitalized aspect of the stories. But one I do sometimes wonder is how not everyone finds it so comfortable to be so open and non-hierarchical, and how do we try and combat that, because some people find this really uncomfortable?
It's a really good question. Karen and Damon, because you've both been through the process, I wonder whether one of you might like to respond to that.
Yeah, I think I could respond to that. I think the part of the process is that Pip and Tony sort of gently supported us in a really nurturing environment, and that nurturing environment made you feel very safe and encouraged you to be brave enough to be fearlessly vulnerable, and that fearless vulnerability I think is where the real power is. But you can't get that without that lovely nurturing environment that Pip and Tony were able to provide.
And thank you, Damon. I think that's beautifully put. And so it's Karen. One of the things I perhaps didn't say at the beginning was that I made a digital story myself. I asked Pip at the beginning of the project how I might be able to understand, if she could explain a little more to me about making a digital story. And she responded that there was no way of explaining it, so I would simply have to participate in a workshop, which was absolutely right. I'd completely echo Damon's thoughts about the nature of the workshops. And I guess having now shared my story with colleagues and listening to Natashas' account and others that are to come yet, I think what it is that perhaps might enable others to feel braver about sharing their stories and responding to Kenneth Schwartz's message about maybe not always hiding behind our professional selves and showing more of ourselves and connecting more with ourselves, is I think it needs more of us to do that. The more people do that, the more others may have the opportunity to be more comfortable with it. I think the challenge that we have is it, as you say, it's new. Not everybody's comfortable with that, but I really think it needs more of us to do it, to begin to shift some of that thinking and shift some of that culture.
It's Mel again. Sorry, totally agree with that, and thank you for this, because I think yesterday I was talking to some staff about how we look at the relationship between carers and the staff at a respite service for young people with complex physical health services, and they're just really worried about bearing themselves. But I think by maybe sharing one of these digitalised stories, which it does actually give people a bit of a wall to hide behind, because it's not exactly face-to-face in that interim period, but then could open up further discussion from there, I suppose, is what I was thinking.
Yeah, I agree, and interestingly, not part of today, Mel, but we have been sharing stories, had patients involved in sharing the stories and having patients' feedback on how they respond, and I have to say it's just enormously positive to have the opportunity to connect on a different level and to connect as people. As we say, it won't be something for everybody, but we just need to open up the conversation and create some different conversations.
I think the other thing, this is Pip again, that I just wanted to say is that we do try to make the workshop space very, very safe. So we have parts of the workshop that are confidential, and we ask everyone to agree about that. And I think the other thing about the digital storytelling process is that it really empowers people to tell exactly the story they need or want to tell, so they can decide how vulnerable they want to make themselves, how much to reveal. So it really is up to everybody. I mean, Natasha definitely went for it, and I think it's a really courageous story. And interestingly, we do have very many courageous stories, but we have some people who say, no, I'm quite a private person and I'm prepared to talk about X, but I'm not prepared to talk about Y. So I think there is something about really giving people the opportunity to make the decision about what they want to share themselves.
Yeah, I agree. And to your point, Mel, about people feeling brave, there's really something I think about how, having experienced this kind of story themselves or watching someone else's story, perhaps just enables people to be a little braver about aspects of themselves that they might share with patients or share with other staff members as well. So I think one of the other things that's emerging from this work is sometimes how little, as staff members working alongside one another, we really know one another. So I think there's a conversation as well that these stories can prompt. Not everybody might want to make a digital story, although it would be lovely if more and more people did. But I think that the benefits of hearing other people share can be a real catalyst for how people think about their professional selves and how they engage with others.
Yeah.
Thank you. Thank you.
So interestingly, I think some of the things, Karen and Damon, that you've been saying is echoed by one of the storytellers, not necessarily the storyteller in the picture, but certainly somebody in their kind of evaluation after the workshop just kind of talked about that it takes a lot of guts to share this deeply and not hide behind our professional selves, but that it is actually okay to share our stories, and that hopefully this will allow us all to communicate better in the future. So I think all of the points that you've been making about vulnerability and courage are really relevant and important here. So shall we, unless anybody else has any particular comments or questions?
Pip, would you mind if I just said one tiny thing? It's Karen. I was thinking about Natashas' lovely recording that she shared with us, and one of the points just towards the end of that, when she said about the way she was using her story, and that she really felt the story had the real power to convey some messages that a business plan or a business case might not quite be able to connect with. And I do know that Natasha is beginning to use her story and the stories that then she's gone on to create with her team and patients in that way, to really try to convey to others the essence of what it is as a team they're trying to achieve together. So just really wanted to just to highlight that point.
Thank you. Yeah, it's a really important point that the stories can really contribute to change. I'm guessing that Damon may say a little bit more about that as well. So, Damon, would you like to introduce your story, and then we can play your story, and then perhaps you'll want to talk a bit more about it afterwards? Or?
Sure. Like many of us here today, as an anaesthetist, I've also experienced life at the sharp end of the needle as a patient, and I thought it would be useful to share my anxious experience as an anaesthetist, and honestly to be sort of vulnerable enough to accept a bit of anxiety as being a patient and a member of staff. So hope you enjoy my story.
Looking out.
It's so nice to see your story again, Damon. I do love watching your story.
Thank you, thank you.
So are you happy to take some questions?
Yeah, I mean, I thought I would just give a little bit of information about what's happened since the story. One of the things that's happened is there's been a catalyzing of slightly different conversations within the organisation, and the strategic corporate objectives have now been amended to include a desire for the organisation to increase the use of patient stories. And that may have been subtly influenced partly by this story as a member of staff. This story was spread throughout the organisation on our intranet site, and I think it's just slightly raised the impression that, you know, staff as well as patients can be anxious, and there's a very important drive for staff well-being at the moment, and certainly within my department we've raised this anxiety as a major issue, certainly for patients but also for staff. So it's been very important and quite successful, I think.
Thank you, Damon. So does anybody have any other questions or comments that Damon might be able to help with at this stage?
Hi, Pip. I wasn't sure if there was any questions that have been posted in the chat box. Maybe Lewis could field some of those questions.
Good idea. I've sort of been watching, and apart from the huge question,
Lewis, are there any questions that you'd like to field back from the Twitter and from the chat box? That'd be fantastic.
Hello, yeah. So on Twitter, a lot of the conversation about compassion and about how you've got to be open with yourself and others as well, and about how that grieving process needs to be open but also safe. That's come from the chat box. So it's just really interesting to see people really are more talking in the chat box than on Twitter, and I think because they're just enthralled by what's on the screen. So Twitter's a bit quiet, but the chat box is really interesting to see actual conversations going on as well there. And a lot of thanks to Damien coming in on Twitter as well now, saying thank you for telling your story, and how that's helped them as well, possibly tell their story.
Because I think one of the things that I've started to realise is that conversations subtly influence the culture, and in many ways the culture is a corporation of conversations. So the more we talk about this, I think it will subtly improve the culture in the NHS. So I think it's important.
Damon, it's Karen, and I love the way you describe the impact of your story as maybe slightly influencing the strategy. I think it seems to me like an enormous step forward. And I think you raise an important point there, and a challenge for us for the future is to really understand much better about how making digital stories and sharing digital stories really works as a catalyst for change and for improvement, to really begin to track and maybe monitor some of the journeys of some of these stories, and that's something that I think we really, it's a challenge for us all to understand that better. I'm sure we won't understand all of it, and as the stories begin to move in some strange and beautiful ways, but I think tracking and monitoring that could be really, really valuable, because I think they're probably even more powerful and even more impactful in changing conversations than we've been able to just be aware of so far. Yeah. Damon, would you mind saying something about other places you've shared your story, or other people you've shared your story with, and how they responded?
I think the biggest impact I had was with medical students. So I gave a lecture at their Anchor Day, which is the last lecture they get at UCL before they become junior doctors. And I opened the lecture with my story, and the feedback from the medical students was profound, actually. They'd never seen a doctor being vulnerable before. And I think as an anaesthetist, you know, you have to be very calm, and you have to be very self-assured. So I think it was very, very useful for the medical students to see that it was okay as a doctor to admit some vulnerability. So that was one of the most powerful feedbacks I got were from the medical students. We also gave the talk to summer school, which is school students who are thinking about a career in healthcare, and again, showing some self-compassion and admitting some vulnerability, I think was very powerful for school students thinking about embarking upon a career in healthcare. So yeah, these are two examples that really felt very powerful for me as an individual.
It's really nice to hear that, Damon, especially about the medical students. And we've actually done some work with medical students, as some of you may know, and helping them to create their own digital stories. And what was interesting about that is that it offers them an opportunity to really think about why they went into medicine, and to kind of consider the kind of doctors they may be going to become. So I think the opportunity to watch somebody else's story is profound, and that opportunity to make your own story is potentially even more profound, I think.
Yeah, I agree.
Yeah. And that's wonderful to hear about your courage in sharing the story with students and with school students, medical students and school students. I think just such a fantastic example of how we need to think about building in this way of thinking, this way of working, this way of sharing with one another, actually on people's journey towards being healthcare staff and healthcare professionals, so that we're building it in, almost building it into people's DNA as part of their professional journey right from the start.
Yeah.
So we have about 15 minutes left. We have one more story we'd like to share with you and hear from one more storyteller. Hopefully, there's some nice comments appearing in the chat box. It's really nice to hear what people are thinking about and about building capacity and really promoting the need for greater compassion. I think the next story, Rachel's story, will also kind of reinforce that, those ideas. So Rachel suggested that we might play her audio recording first, and then we'll play her story. So here's what Rachel had to say. Oops, hang on a second. Sorry.
So she's stuck at London Bridge, but she's on her way. Do you need a appointment? No, she needs to go to the ward at 10:30. Let me see if she... Shall I just go... So I can meet her straight up there. She said shortly. Which ward? No. She knows about it.
So thanks to Rachel for taking the time to record that. So I'll play Rachel's story, and then again, we'd love to hear your thoughts and reflections. I probably just should warn you that you really might want to have a tissue handy for this one. And also don't worry if you don't hear anything at the beginning. She doesn't start speaking until quite a few seconds into the story. So here's Rachel's story. So I hope you enjoyed that. It is a very touching story. I know one of the things that Rachel said, apart from feeling as though she'd had 10 years of therapy in a few days, I think she felt that it just really brought home the fact that you never know what's going on with your colleague. And unless we actually make time to listen to one another and share stories with one another, you never know whether someone has just lost a relative or someone dear to them, whether they've got some other trauma going on in their life. And so I think for Rachel, one of the really important aspects of the whole DNA of Care project was just a kind of reminder that we need to make time and space to listen to one another's stories. So any questions, any comments about Rachel's story that Karen and Damon and I can try and do our best to answer? As everybody stand into silence.
Paul, I don't know what the facility is for people unmuting themselves, if they can do it independently or whether they need to ask in the chat box. But it would be great if anybody
people want to ask a question. If they raise their hand, I can unmute them.
So, so you can raise your hand by, if you look along the list of participants, you've got a hand that you can raise along the instructions with like emojis and everything. So it'd be great if people want to get involved and be part of the discussion this morning. So one thing I was thinking about in all this is about how we can use this moving forward, because I find these patient stories so powerful, or these staff stories so powerful, should I say, you know, it'd be great to see them used more widely across the NHS, and I just wondered if there's any thoughts on that, if anybody's got any suggestions, or perhaps I could put it back to the panel.
Karen, do you want to answer that?
I think, well, I think events like this and others that we have held, very much trying to encourage people to do that, and so the more people that are sharing the call with us today can raise awareness with their colleagues, then the better. I think Rachel also spoke to part of that that's really important for us now. It's, you know, clearly today we've been talking about sharing the stories and the human connection and how that appeals to people, and that they then change conversations and want to make more stories. But I think Rachel's is really helpful. Rachel is focusing her master's dissertation research on the experience of making stories, but also the impact of making stories. And my sense is that's going to really help us too, to be able to share the stories, but actually share what Pip and I have started to call the story of the stories. So what these stories help us to do differently, what's some of the impact and what's some of the evidence behind that impact as well. And to be able to put those two alongside one another. So there's the kind of the human side of the story and the people that appeals to, but also the more evidence-based side of the impact of the stories, particularly staff digital stories. And it's my sense that those two alongside one another will really help us promote the stories even more effectively, and encourage even more uptake.
That's fantastic, Karen. And I you know, completely agree with everything you said. And maybe people that want to be more involved or want to see how they can get involved to spread these stories across their local systems, perhaps they could put messages in the chat box or contact us afterwards, because you know we really like to build that momentum.
We could absolutely, and actually that's just prompted me to remember we are now in NHS England just through people the range of people who've perhaps come to events and joined this kind of conversation. We've had some contact now from a couple of universities who are asking us to work with them to match some of the stories to some of their module content, to look at the potential for encouraging stories to be included as a different way of conveying messages, as a different way of presenting information. So it's fantastic that some of our universities are wanting to take that forward. But similarly, I guess there are a lot more opportunities like that. And for me, the real key is for staff digital stories to become embedded in the way other people do their work, facilitate change, and so on.
So, Karen, we've got a couple of people who are wanting to ask questions or make comments. I think Paul can unmute you now, and then I think Janet was also wanting to speak after that.
Okay, can you hear me?
Yep.
Yeah, brilliant. Hello to everybody, and thank you so much. There's so much going on in my head here, and you can see I've put the question there, and you partly answered it in terms of what's happening nationally. But I'm really intrigued by having just done an NHS Leadership Academy course, and a lot of the patient stories and patient voices being prevalent through that as well. Recognising, though, that a lot of the change that we can do is small scale and at the edge, really, rather than in the centre. And you can see the question I put there is what's happening, I suppose, at the senior levels in organisations, but also from NHS England to change that mindset, because I get a lot of, I'm sure other people experience this as well, sort of the tokenistic patting on the head of that's a lovely fluffy story, but what does it really mean when we've got huge waiting lists? And I'm just interested in what the centre of organisations are doing to combat that view, really.
So perhaps if I respond to that, firstly, I think the essence is trying to marry up the stories and the power of the stories with a stronger narrative about the evidence base and the differences that they make. And that's very much about encouraging and working with those people who use their stories and share their stories as part of their change initiatives, to actually work with them to try to capture some of the other data that reflects that. Because we have so many stories now, when we watch the stories, with some of them, it's not very difficult to see how that person working differently now makes a change to the system, and may have there's a quality improvement story attached to it. There's a financial resource story attached to that story. And one of the things that we need to do better to be able to be more influential is to join those up. So that's one. I don't know whether you've got more to add to that, Damon, from your experience.
I think one of the cultural changes that's happening is the understanding that you don't need data and stories. You need them both together to really connect people to any kind of change. And I think in the small local environment, I think making time in your day to actually listen to each other's stories, especially as the system is very stressed and people are very busy, I think the most impactful thing you can do is actually take time and pause to listen to each other's stories. And certainly I think that is the potential catalyst for big cultural change.
Yes, completely agree, yeah. Thank you. It's a big question, but thank you.
No, it's a really good question, and I think Natasha alluded to one other thing for us to think about is now, Natasha is some big service changes that she just alluded to, and is really thinking about how taking a digital story as a presentation, for example, to CCC board or to other kind of key leadership forums, actually is a very different way of engaging people in the change that we want to see and the change that we want to drive.
So I think sometimes rather than talking about the impact of the story, the key move is actually to show the story in different kinds of settings, and not to restrict that to small scale improvements, to be courageous and take those to some of the very senior settings too. Yeah.
I was going to add to that because it kind of builds a bit on what we were talking about yesterday at School for Health and Care Radicals, School for Change Agents, and that is that, you know, change now is, you know, change starts with conversations, and stories are a great way to start conversations and connect people with the heart of the change, and, you know, that will improve the long-term efforts and sustainability and the spread of our change efforts. So, you know, for me, you know, change starts with conversations. This opens that up and connects to the real values behind the actual improvement itself. Pip, was there another question that you had?
Well, I think we're good. I think
the time on, so I probably stop. But yeah, thank you so much. That's been a good answer and lots to think about.
I think the other question was answered, and I'm aware we're over our time now, so I might just move us on to the pretty much. Well, I think this is possibly quite important that many of the people who participated in the workshops felt, as Vanya said, that they were able to actually accept themselves much better, that the opportunity to make a story is personally transformative. And I think hopefully those personal transformations will also go on to contribute to wider transformation. It's really interesting that a lot of the questions you are asking are what we can do with the stories and how they can make a difference. So things that you might be interested in participating in a little bit later on in the year, well, not too much later on, actually quite soon. The Experience of Care Week is coming up, so you might want to just watch the hashtag #ExpOfCare, and that there will be a webinar as part of that project on the Wednesday afternoon, the 23rd, I think that one is, and we'll be talking about some similar things to what we were talking about today. I've been asked to remind you, please, to complete the feedback form, the WebEx feedback form, once we've actually finished the WebEx today, because it's really helpful for the Horizons team to get a little bit of feedback about what's going on. We'd love to hear from you at Patient Voices UK if you're interested in the stories, or I've put my email in the chat box, so if people want to contact me, and Karen, I know, will be very happy to be contacted.
Absolutely, absolutely. Could I just say something very quickly about the Experience of Care Week as well? It's a week that's a collaboration between NHS England and NHS Improvement, and a whole series of activities and webinars that week. But really, perhaps in response as well to the last question, is previously we've talked about patient experience, then we've talked about staff experience, and they're absolutely both critically important. The way we're beginning to frame that now and describe that now is as experiences of care. And I think that might, for some, be kind of semantics, but it's really important, I believe, in terms of how we frame all of this work going forward, that we start to talk about experiences of care and think about patients and staff in the same conversation, in the same initiative, and in a very connected way. Thank you, Pip.
So thank you for the session today. I don't know if Pip or anybody's got any closing words before we finish.
Just to wish everyone a great weekend, because it's Friday.
Thank you.
Yeah, and if you want to see more stories that were made as part of the DNA of Care project, the link is at the bottom of the slide, patientvoices.org.uk/DNAOC.htm. There are lots of stories there. So if you haven't got anything better to do on a rainy weekend, you can watch stories.
They're great, the stories.
And please, if you are, when you access the stories, when you find it on the Patient Voices website, if you use stories in your own work, please share with us how that goes, and please share with us the impact that they have, because we're absolutely committed to learning about how that works, but also learning how to do it even better. So please share that.
Thank you. And Lewis, could you tweet that link out? That would be fantastic, and then people can get it via social media as well. So they don't worry about writing it down. So thank you. So that comes to the end of today's session. Thank you all for joining and taking part. Just to say, there will be a questionnaire that will be sent out, and we're really keen to kind of get the feedback, as Pip said, and be looking at that continual way of how we can develop and improve the experience of the EdgeTalks for people. So thank you, and thank you for joining today.